What I'll do now is ask the panelists to give a brief, really 30 seconds response, and then I'll give the microphone back to Leo, because we said we would round up by a little after 5 o'clock. So I start the other way around now. Mr. Mohammed, Dilgo Mohammed, could you?
Well, I think CBHI is a solution to attaining universal health coverage. And we have to start through piloting them, and then we learn by doing, and that will give us the opportunity to have different products customized to different segments of the population. And as we go gain more experience, we also build trust, because once they see it is working, then people will start asking questions. How are you on this? Then they become the ambassadors, and then you find that to scale up becomes a lot easier. Thank you.
Okay, thanks very much. Stella.
I guess whatever solution we sort of decide on, and that's something that we cannot resolve today. The important point is that we made the first step today, which is we got together and sort of interacted and talked about what's out there. So again, I'd like to thank Her Royal Highness as well as the organizing committee for bringing us all together today. It's a very rare opportunity for us to spend an entire day just talking about health insurance, which is usually embedded under like broader topics like health systems or maybe microinsurance. So thank you for this opportunity.
Thank you, Mr. Stein.
Yeah, I would like to come back to Princess Maxima's initial 4 points as to what we want to achieve here today, right? So identify the knowledge gaps, prioritize pilots, agree on what are the successes and failures, and then call attention to the importance of the subject. It feels to me like it may be a worthwhile effort to really engage in a stock-taking exercise to bring all of this knowledge that we have in the room here together, right? And just document this properly and use that as a way to connect the practitioners, right? To get everyone in a room, but then also use that to disseminate those of the things that we know that work and that don't work, and then also be honest about what are the areas that we still need to do more work and hence engage the community out there to close those gaps. And I think that would go then also a long way to engage the political community, depending on whether we do this at the UN level, at the G20 level. I mean, there's different ways to place that, but I think that would be probably a worthwhile effort to do.
Thank you, Madam Dorasil.
Yeah, thank you. Maybe 3 quick points. I'm still, one point I'm hear quite often, the political will in countries. You mentioned it as well. Maybe we should engage a bit more in some of these organizations with political leaders of these countries, because sometimes I'm wondering how you bring this will about. It might, the assumption is that might not be enough pressure groups internally to create this political will. Secondly, on what we can do also, because I'll be coming more from the donor side, Per already mentioned stock-taking exercise to look at the knowledge base we have, but maybe we should reach out a bit more to the private sector, more than we have done today, and we can use formats that we have already for that. For instance, learning from the microfinance community, where there's a micro insurance network that also has private sector in there, and at least from our side, what we already prepared to do as a forum where we bring together regulators, private sector, and also addressing the financial education aspect you mentioned on insurance. What we would like to do together with IS and all the other partners involved and our supervisors to have a responsible finance forum that's a specific format looking at these 3 issues: consumer protection through regulation, self-regulation, and financial capabilities or financial education in the insurance sector, because that's a very specific sector. We can look at the different insurance products for the different purposes and objectives, but also looking around this trust issue that came up like throughout the whole session, how to create the trust from the consumers, but also how the regulators work with the private sector, and a bit of getting down these kind of, the government is just in our way, or the private sector is just the bad guy just running behind profits things. So, and then we can really ask them, what are you prepared to do, regulators? How are you? Private sector can give themselves some code of conduct, so it's possible. So we don't have to wait for the magic bullet. We can start doing things. That's a little bit my plea, so demystifying the whole thing and not trying to just to do everything at once, but being fairly pragmatic about it. So at least that's what I can promise here.
Okay.
To try to convene it in that space.
I think it may be a bit underestimated the role that the private sector could play. And then also how we can support, and we were in this interesting group already, we started a bit yesterday with FMO and IFC, how can we jointly support these private sector actors in developing countries to really become a flourishing sector where they can really expand, and so that it really, our dream comes through.
I haven't been to the meeting where there was this insurance on loss of income, but it actually made me think, when I started getting into health insurance, I started looking at the history of health insurance in the Netherlands, because it's like, one has to know its own system before you start talking about other systems. And the funny thing, the 17th century, in the Netherlands, the only somewhat close to health insurance was actually the guilders, that they would actually be solidary among each other. And when somebody, one member, was ill, the rest would actually pay for their lost income. And that was the beginning of the whole health insurance in the Netherlands. So I thought, when I was told this example, I thought, how funny things are. In different moments, it is also about economic losses. It is also about expenses. And I think you have to start somewhere to start building up. Anyway, there is no process that has a public element that does not need political will. And asking for money or spending money is easy. What is difficult to convey is that it's about processes, it's about institution building, and it's about infrastructure building. And it's about stimulating investments, which is something we've been hearing today. Now the issue is, how do we access these politicians? One thing that I've found since I started dwelling with this issue is there's no international organization that dwells upon health policies. Not just one house that actually houses good practices, bad practices, that actually carries research, has data, etc. So that's one thing I would love to leave it to the table, at least to the room. But before we actually speak to politicians, I think the message is not there, is not ready yet. Because like somebody rightly said, we don't want all of us to come with different messages to different politicians and confuse them more. So I am really happy that IFC and German Foreign Ministry, together with my ministry, has actually been talking about a stock-taking exercise. I hope this is an offer. No, but I think, we really have to work on this. And definitely what has worked, what has been, and what are the criteria we're going to be using to identify what has worked and which are, I think that we need to spend some more time in talking about these issues. I've sort of come up with a list in terms of outreach and take up, which groups have actually had access to this health insurance or not. Spillover issues, does it actually has meaning to access to health beyond the insured group? Sustainability issues, health outcomes, of course, and we're talking there about quality of health. Of course, when I talk about sustainability, we're talking, of course, about sort of subsidies and, premiums, and how do we subsidize the whole system, and how do we probably reach the small and the big that Dr. Dror was talking about. Also, relationship with other financial services and other social security measurements, and also issues about sort of different levels, like we also, Dr. Dror talked about the reinsurance, which I think is something we've actually spoken very little about. So maybe I would like to have some more discussion about what the criteria is, but I'm just throwing some to the room. The other issue that was not very spoken, at least, I mean, there's a need for regulation, but nobody really has said exactly what is it that we need from the regulation, and possibly standard setter. Solvency issues, ID issues, franchise regulation for health providers. How do you incentivize, therefore, investments? I mean, Mr. Jan, you just talked about it a little bit. But I think that, you know, a lot more needs to be, you have to, all of us, we have to think a little bit more, what is it we want the regulator to do or not to do? Because it's one thing that we cannot do is actually start talking to regulators and tell them, you have to regulate, because regulate before actually something is there is very dangerous. It would just do the opposite that we want it to be, and that is to foster, not to foster investments. Another third issue would be the data, and data being actuarial data, data in general, research, evidence-based research, demand-driven research. I think that was a very important by Professor Kimbo. But I think that we need to sort of start looking into, and that's where the donor community really can do a lot of work, because that's not a very exciting, politically attractive element, is collecting data and doing that heavy work. So I think that donors, like as USAID have actually done in the Philippines. And then last but certainly not least, I think that behavioral dimension and uptake, price, non-financial incentives, the huge issue of trust, whatever that might be, because I think people have defined trust in many, many different ways, and I think that, you know, a little bit more of a consideration needs to be given to this issue. Psychology, I am an economist, and sometimes I think that, you know, when you look at fantastic function, there's always a nice Greek symbol, and it's all about expectation psychology, which I can throw the whole formula away. So I do agree. So therefore, this qualitative research needs to be done a lot more. And in this behavioral dimension, I would include education, because that is definitely something that controls, or at least sets where expectations are going to go towards to actually match the issue of trust, is going to improve demand, and focus basically the whole population towards how health insurance could actually help them. I've heard that there's been a lot of ask to actually get this health insurance issue and run with it. I will do my best to keep on conveying this, but I also need from practitioners and from research, academia, and other donors a lot of information to actually be able to do this. And probably that was my first wish when we started to do this. You know, we need to get more information out. So I know that Brazil is extremely interested to following this up as well. So maybe you would like to say something. But I really want to thank everybody here for giving this a fantastic, making a fantastic day. I've learned enormously about, you know, health insurance, about the many, many aspects. It's not easy, and it's a complicated issue, but certainly something that is really worth going for. So thank you so much. And again, I would like to thank the ISS, the Erasmus University of Rotterdam, the Ministry of Foreign Affairs, and Pharmaxis to giving so much content and so much passion to this conference. Thank you.